Good afternoon. Yes, it's almost 2 o'clock. We're here for the Metro Health Department's budget hearing with the mayor, and I'm joined by Council Lady Taneka Vercher, who's out there in the audience, the chair of the Council's Budget and Finance Committee, by the Finance Director, Ms. Talia Lomax O'Neill, and by the city's Chief Strategy Officer, Mr. Brian Kelsey. Before we begin, I've been starting with a little preamble, which is that, as you know, the city has had record revenue increases over the last couple of years, which has allowed us to do some across the board and pretty serious enhancements in some of our departments. This year, we're not anticipating quite that same level of revenue increase. So in order to stick with our current historically low tax rate, we're asking departments to come with a status quo budget. I know that much of the money going through the health department is not local money, but we do appreciate your coming today. And Dr. Paul, if you could introduce yourself and your staff members who are with you, and then we'd love to hear a brief overview of the department, and we'll probably have some questions at the end.
Great. Thank you, Mayor Briley. I'm Dr. Bill Paul. I'm Director of the Metro Public Health Department, and with me is Peter Fontaine, who's Director of our Bureau of Administration and Finance, and Diane Harden, who's our Finance Manager. Go ahead.
Go ahead. Go for it. Yeah.
Okay, let's go to the questions.
Okay.
And that's about it. The mission of the Health Department is to protect, improve, and sustain health and well-being for all people in metropolitan Nashville. It's a big mission. It's kind of like being the doctor or the care team for an entire county. And so we know, we take it seriously, but we know we can't do it alone. I want to talk just for a minute about Nashville's health. Our county health rankings came out recently, and over the years, recent years, we've gone from 13th in Tennessee to 6th in Tennessee. Well, that's encouraging. Tennessee and Nashville both have significant health challenges and areas of concern. One is chronic disease, with the triad of smoking, physical inactivity, and unhealthy diets. Our smoking rate is higher than peer cities. Our obesity and physical inactivity are no longer getting worse, but they're not yet at healthy levels. And these three things really link to our top causes of chronic disease and death, and also to our prosperity. For Nashville to prosper, we need a healthy workforce, and these are going to be some key ingredients to keep working on. Second, our health varies widely by neighborhood. Residents of some zip codes are living many years longer than residents of other zip codes, and that's not fair. Everyone should be able to live a long, healthy life no matter where they live. Third, and this is relatively new, after many years where the early deaths were declining and people were living longer, we're starting to see more earlier deaths and shorter lives. We do know one reason. Like other places in America, we are seeing an increase in deaths from drug overdoses, and that can be a significant explanation of the trend that we're seeing. So Nashville's very rich in health care. It's crucial that we have a medical safety net that works, but most of our health actually happens outside the doctor's office. Even if we got health care perfect, we would reduce our early deaths and improve our health by around 10%. So our health is actually shaped by a lot of the things that we don't ordinarily think about as health: housing, home, education, food, places to be active, ability to get from one place to another, safety, economic security. Opportunity and health correlate almost perfectly. So what's the prescription for a healthy Nashville? One prescription is to always work upstream, to always be thinking about investing in prevention. Another prescription is to be in a habit of making healthy policy decisions. We call it health in all policies, or a culture of health, and that's inside and outside of government. The vision is that just as music is woven into Nashville's identity, we need to weave opportunities to be healthy into the fabric of the city. And I think Nashville's really moving in that direction. We were really pleased to learn this month that Nashville is one of 10 finalists nationally in the Robert Wood Johnson Foundation Culture of Health Prize, which is kind of a big deal and a recognition that we're doing some things right. So the health department. What do the men and women of the health department do? Simply speaking, we provide public health services, we enforce health regulations, and we work as Nashville's health strategist. We lead and support collaborative efforts to improve health in Nashville. And if I may, I'd like to share just a few successes from the last year or two. First, our dental program, which is all about being upstream. It's all about preventing dental disease in children, and we're making great progress. We've been a leader in the use of silver diamine fluoride, which is a very inexpensive but very cutting-edge treatment that stops tooth decay in its tracks. We've started a new WIC dental collaboration program that's been operational since September, and we're now evaluating the impact of this program on oral health for WIC dental patients. School nursing. We successfully implemented the first of what we hope will be 3 stages of expanding nurse coverage. And to improve student outcomes, metro schools really need to reduce chronic absenteeism. To improve student outcomes, metro schools need to reduce chronic absenteeism, and nurses are a big part of that. Here's a couple of examples of what we've been able to do with the increased investment this year. As time permits, our nurses are getting the list of absent students from the school daily, making phone calls to the parents in order to offer information, provide support, create a sense of trust and connection, teach parents about the role of nurses in schools. And as parents are more comfortable and know there's a nurse there, they'll get their students back to school more quickly. We've just audited the 6th grade immunization records in order to identify students that need that shot before they start 7th grade. Reminders are being set, and we expect that updating immunizations during 6th grade will avoid kids missing school when school starts in 7th grade in the fall. Metro Animal Care and Control. We're proud of the progress that we've made with community help in the last few years. We've lowered the euthanasia rate to all-time lows. Our current average is below 12%, and only 4 years ago it was 76%. In the last year, we adopted an electronic license entry and tracking system, which is way more efficient than what we had. This allows real-time access to the address of a lost animal. It's a huge improvement from our previous paper-based system. And the system also reminds pet owners when their pet is due for vaccination, which should help increase our coverage against rabies. We work with community partners in the SAFE Coalition, and this is a Metro-funded program that supports community partners for the most at-risk animals to achieve our goal of saving all healthy and treatable animals. So far, the coalition has funded 400 targeted free spay-neuter surgeries for adult cats, 300 for owned large dogs in 3 targeted high-risk high-intake zip codes, as well as incentives to some partners for pulling at-risk animals from MAC. So beyond the direct services we do, we are making some headway in this strategist position where we try to create healthier conditions by getting organizations to work together to change systems and change policies. And here's just a few examples. With adverse childhood experiences, these are serious events like abuse and neglect, also known as ACEs. They have profound negative effects on people's health throughout their lives. And so as a community, Nashville started prioritizing the impact of trauma on the developing brain as a public health issue. And we're working to improve systems, policies, and practices to lessen the harm from ACEs and promote resilience in families and communities. The Health Department is a leadership and a support role for this, the coalition, All Children Excel Nashville. And this is a broad group of human service organizations that are changing practices and programs and policies to reflect our current understanding of how healthy brains grow. The work is aligning closely with the Mayor's Office of Resilience. We're also piloting a project to promote a trauma-informed organizational and service culture within Metro, starting with the Health Department as a pilot. Community health systems improvement. Our systems for treatment of mental health have been frayed and underpowered for a long time. The jail has become a default provider of mental health care, and the sheriff's right. About 30% of detainees in the jail have a mental health issue. Over the last 2 years, we've convened with hospitals, mental health providers, and criminal justice officials to improve systems of care and support. One crucial success is the strengthening of the Mental Health Cooperative as our community's 24/7 mental health crisis center. We broke ground last week, but services are already being changed to facilitate quicker entry into care. This is a true community plan, and by coming together to create that plan, we were able to leverage $2.6 million in capital funds from the state for this service improvement for people with mental health crisis who need treatment and don't need to be sucked into the criminal justice system. This is a pre-arrest effort. It's going to be very complementary to the sheriff's plan, which is a post-arrest effort, and it's mostly for people who are not in mental health crisis. And so this work group will continue to seek out opportunities to make mental health services work better in our community. Infant mortality, fundamental reflection of our community's health, and we have convened and led the Nashville Infant Vitality Collaborative, which has really had a campaign to reduce the number of sleep-related deaths among infants. And it's the ABCs. Every baby should be alone on their back and in a crib when they sleep. Last year, we marked a 30% decline in sleep-related deaths in Nashville. Lastly, opioids. The opioid epidemic in Nashville continues. Last year, we may have seen some leveling off in overdose deaths, but 208 people lost their lives last year to opiate overdoses. 85 of these had heroin in their blood when they died. 84 had fentanyl, and both of these numbers are increasing. Our team has made improvements in real-time tracking of overdoses, looking for clusters and patterns. We brought stakeholders together to exchange information, built lines of communication support with police, fire, along with the Nashville Prevention Partnership, Tennessee Department of Health, Tennessee Department of Mental Health and Substance Abuse Services. We supported StreetWorks, becoming the first sanctioned syringe service program in the state. We've been working to expand access to drug take-back services, which is sounds simple, but it's really important. Too often the story of somebody facing lifelong addiction starts with a bottle of leftover pills in the drug cabinet, medicine cabinet. So there is a lot of work yet to be done. There are gaps in availability of treatment. There's increases in funding becoming available at the state and federal level, and we will do whatever we can to help Nashville knit those things into a system that works better. That's enough for now. I'm proud of the men and women at the health department. I work every day to make Nashville a healthier place. I'm proud of the work that our city's doing together to build a culture of health. And thank you, Mayor Barley, for your attention and for your support of our work.
Thank you.
Let me just say thank you for cooperating, you and your team, with the finance team when we come knocking at your door, and as you have been cooperative and understanding regarding the status quo budget request, and it's appreciated. I'm going to save the PIP questions for Brian because he probably has a couple of them. But there's a couple of things on here that you've highlighted that I do want to ask about. One specifically about, we gave you an improvement last year for an opioid coordinator, and we heard earlier this week from the fire chief, I think that he said that they were delivering 100 doses a week of Narcan. I just want to get feedback from you on that number because that just was a really big number to us. I mean, can you tell us about what you're finding in your initial research or what this individual is looking at today? I just want to hear from you on that.
In terms of, I mean, one of the things about, I mean, I'm not a firefighter, I'm not an EMS, but I did train in medicine, I did work in emergency rooms. And if you go out in the field and somebody is down, unresponsive, Narcan is part of what you administer no matter what you're thinking. I think probably the, and so that the use of Narcan is probably, you know, probably years ago people might have had stereotypes about, oh, this person looks like they need Narcan because of the scene I'm at. That doesn't work as well anymore. And so I think generally it's a part of responding to the community. We
So
don't
that
have.
won't necessarily have a direct correlation to the data that you're tracking on
Well,
your
right.
side.
We don't have a blood test on everybody who gets Narcan. We don't have that. What we are able to do is, and there are a lot. We track overdoses by reports from emergency rooms, by looking at the diagnoses made in emergency rooms across Nashville, and there's a large number.
Okay.
I don't know specifically about 100 a month.
Yeah,
How many
that
of those
number
are.
just really caught our attention earlier. And then the ACEs program. Can you tell us a little bit more about the collaborations that are happening with that? Because I know that every opportunity that Judge Callaway has to have your ear for 2 seconds, she'll talk about ACEs and some of the things that she thinks needs to happen. So it's kind of out there in the...
It's definitely out there.
Yeah.
It's definitely something that human services organizations in Nashville are excited about, and they're excited about like working together to move the needle and change what's going on in Nashville. Examples of, so certainly Judge Callaway is a huge champion, and the idea of rethinking juvenile justice. In a nutshell, it's moving away from looking at a child with troubles and saying, "What's wrong with you?" to saying, "What happened to you?" And so your whole mindset changes, and the set of skills and tools that you use to try to make things right that are wrong changes. And so Judge Callaway is a big champion. Metro Schools is on this path as well, and there's some phenomenal things going on with Metro Schools, both in terms of pushing for social and emotional learning, but also how classrooms are managed and what the culture is in a school, that the educators are more attuned to be trauma informed. We don't always, we get some grants, but some grants are better not coming to the health department. One of the things that this coalition did was go to the foundations in Nashville, tell them about ACEs, get them trained. And so in each of the, at least the health-related foundations in Nashville, if you're applying for funds, you're telling them what you're doing as it relates to ACEs. And so the idea is kind of changing the culture, changing how we go about human services.
Okay, thank you very much.
Let's see. Let's start with the first public investment plan funded program, the mental health crisis service one. But first, congratulations on the groundbreaking. I know that there a lot of work went into that. You guys, it's a great project. It's a great example, I think, of what we were trying to do with that program and leveraging limited metro money and able to kind of expand the scope of what we can achieve through that investment. This $440,000. This is sort of year two of a 2-year proposal to kind of get this off the ground. I assume we'll need to talk at some point about how to sustain that work. What are your thoughts for sustaining that work beyond this upcoming fiscal year?
Well, my thoughts are that it needs to be sustained and that it's a worthwhile investment. In the big picture, yes, we should have lots of investors in improving mental health systems in Nashville. I happen to think that Metro should be one of those investors because there's relatively little Metro investment outside the jail in mental health systems. So, I don't know what the budget will be like next year or what other potential investors there might be. The state came in big time to make that possible. One hopes that over time we can spend less money on criminal justice and more on mental health. I can't predict that in the space of a year either. But I think, given that we spend a lot of money on incarceration, it would be nice to imagine a dividend where some of that could be invested in health and prevention.
Okay, so between now and this time next year, I guess we'll need to talk about how to sustain that through an improvement request for FY20. Is that what I'm hearing?
Yes.
Okay. On the second one, the animal welfare program, just for the people who are watching the hearing who may not be familiar with what we're doing there, since that project originated in general services and then was moved over, and I feel like you guys are doing a great job continuing that work. Could you just explain what that money is being used for?
Yeah, so it's the SAFE Coalition, and so I may not get every detail right, but basically we're participating in convening folks from the community, knowing that, like, if we're going to do the right thing for animals in this community, it's not all leaning just on MAC. We're going to need to be relying on nonprofits and individuals and in the community. And so part of what this, the purpose of this funding is really to expand spay-neuter through strategic and targeted efforts. And so, whether it's cats in a particular community or dogs in a community where we're seeing a lot of intake to the shelter. It's like there are zip codes where they got more than average intake to the shelter. We're trying to make spay and neuter as available and lower the barriers for people, if they may be financial barriers, so that we don't end up with the cost on the far end of taking in a dog that's not wanted and ultimately adopting, euthanizing their and keeping them in the shelter. Those are all costs that we want to prevent by investing in spay and neuter.
Okay, thanks. That's it.
Anything else?
Yes, sir.
Well, thank you very much. You and I have talked about quite a few issues over the years, gun violence and opioids and the...
Yes, I can talk about public health for a long
time.
And there are things that we left off, but we're appreciative of your support and your understanding that this is kind of a big and long-term enterprise that we're trying to do.
Right. It's changing the arc of the direction. It takes some time, but we appreciate all your hard work in that and all your staff and their hard work as well. So thank you very much.
Thank you.
Thanks.
Thank you all.